Hello guys, welcome to my YouTube channel. Don't forget to like and subscribe. Here I want to tell you about United States health insurance system. How does the US health system works? Healthcare in the United States is organized in a complex bureaucracy, while in the rest of the world, healthcare facilities are owned mostly by government or by private sector business. In the US, a large share of hospital and clinic are owned by private non-profit organizations. Yes, the US is the country that has the highest healthcare expenditure in the world. While these expenditures are covered in a large set by public prayer as by federal institution or state and local government. They can also be covered by private insurance and individual payment. At the same time, unlike most developed nations in the US health system does not provide healthcare to its entire population. As there is no single nationwide system in health insurance, the United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expense for fragile part of the society as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to. Getting health insurance in the US is not an easy thing. Someone may think that once you have money, everything is easy peasy. But in the fact, things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in US for non-citizens. The United States government doesn't provide health insurance for all its people, and health insurance is not obligatory from those living in the US. It is optional, but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurance in the US, private and public. Most people use a combination of both. The US public health insurance are Medicare, Medicaid, and Children's Health Insurance Program. First, Medicare. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for US nationals older than 65 years old, but also younger people with the end-stage renal disease, ALS, and some other disabilities. Data shows that in 2018, Medicare provided almost 60 million individuals in the healthcare in the US, over 51 million of which were older than 65. The Medicare program is divided into four parts. Part A, which covers hospital, skilled nursing, and hospice service. Part B, cover outpatient service, including some provider service, while inpatient at a hospital, outpatient hospital charge. Part C is an alternative called Managed Medicare, which permits patients to select health plan with at least the same service coverage as Part A and B, often the benefit of Part D, and an annual out-of-pocket spend with limit and be like. To sign in this part, one must sign in Part A and B first. Part D, cover monthly self-administered prescribed drug. Then Medicaid. Medicaid is a federal and state program that help people with limited income and resources to cover medical costs, while covering benefit normally not covered by Medicare, as nursing home care and personal care service. It is the largest source of funding for medical and health-related service for people with low income in the United States. Data shows that the US provided health insurance to 71 million people with low income or disabilities, which is 23% of the total of the US population. And then Children Health Insurance Program. formerly known as the State Children's Health Insurance Program or SCHIP. This is a program that covers with health insurance children of families with modest income. They are not low enough to qualify for Medicaid. Then the Affordable Care Act, Obamacare. The Patient Protection and Affordable Care Act is a federal statute signed into law by President Obama, which made it mandatory for every citizen to have health insurance or be penalized. The Act subsidies for low-income families by taxing healthcare providers and high-income families as it was designed to lower healthcare costs while providing better health care for Americans. The Affordable Care Act allows parents and to add their children up to the age of 26 to their policies, in a bid to have younger healthy people paying premium. It also allows poor people to get treatment for chronic illness instead of using the emergency room. Then US private health insurance. There are about 1,000 private health insurance provided in the US, which is of them offering different plans with different prices, which largely depend on a person's medical history. However, where there are individual plans covering only one person, there are also group plans targeting families in particular. Usually, there are three types of health insurance in the United States. The one is traditional fee-for-service health insurance plans, which plans are usually the most expensive that those with an income lower than the average income in the US have difficulties to purchase. However, these are the best plans as they offer you most flexibility. And the second is Health Maintenance Organization or HMOS, which offers a limited choice of healthcare providers, yet it also offers lower co-payment and cover because of the more preventative care. They are evaluated and accredited by the National Committee for Quality Assurance. And the last is Preferred Provider Organizations or PPOS, which just like HMOS offer lower co-payment, but they give you more flexibility when selecting a provider, as they give you a list of providers among which you can choose. That's all. Thank you.